Hello and welcome to Advanced Topics in Medical Image Processing. My name is Hanif Gabrani Juma, and I'll be your instructor over the next few minutes. Today we'll be going over SPECT-CT imaging. We'll be discussing the underlying physics, some hardware and software developments, types of the images acquired, image characteristics, the clinical relevance and uses, and briefly touch on socioeconomic issues. Let's get started. So SPECT stands for Single Photon Emission Computed Tomography, where SPECT imaging is a form of nuclear medicine imaging, where unlike CT, MRI, or ultrasound, where particles or waves are produced outside the body and then pass through the body and are detected, in SPECT imaging the particles are actually emitted from inside the body and then are detected or captured by detectors outside the body. So how does SPECT differ from this? Well, in CT, MRI, or ultrasound, we traditionally obtain anatomical information. So this means we get information about the structures, this means we're getting tissue densities, things like that. Where in SPECT, we actually image at the molecular level. So this means we're getting functional information about the tissues or organs or systems we are imaging. And in many cases, this can result in understanding whether tissue is alive or hibernating or scar. And we can also evaluate the health of an organ or start to begin to understand pathways in our body. So these particles used in SPECT imaging are called gamma rays. And a gamma ray is produced from a radioisotope, which is a compound where a radioactive source is bound to an active molecule in the system being imaged. So for example, in technetium-99 system AB, the active molecule is methyl-oxy-isobutylhistonitroline, which is used to stress and also image the heart. So before the gamma rays reach the detector, the gamma rays pass through a collimator. Now the objective of the collimator is to block photons that are not traveling in a straight path, but that are traveling in an angled path. And what this will do is decrease the noise in the image and limit scattering. Collimators are typically made of tungsten instead of lead to be cost effective, and also depending on the configuration of the detector, the collimators may be parallel or slightly angled. There are three methods of gamma detectors as well. We have glass-filled tubes, scintillation counters, and germanium solid-state detectors. Now, the glass tube is most likely the simplest method to implement. Glass tubes consist of a sensitive volume of gas in between two electrodes. The output signal is proportional to the number of gamma rays detected. So while this is a simple method to implement, the gas-filled tubes has difficulty differentiating between the energies of the photons detected, and instead only counts the number of particles that are entering the detectors. So next up we have scintillation counters, which basically have a luminescent material which detect the gamma ray. Now once detected, the material produces a luminescent signal, which then corresponds to the energy of the photon. A photomultiplier tube then detects the luminous signal. This method not only records the number of photons detected, but can also differentiate the energies of the photons detected. The luminescent material can include cesium iodide, sulfide, zinc sulfide, lithium iodide, or sodium iodide. And however, most scintillation detectors are actually either made of sodium iodide or cesium iodide. Now finally, we have solid-state detectors. This method is the newest and therefore the most complex method to implement. In solid-state detectors, the luminescent charge produced by the photon is collected directly, so this results in a significantly higher spatial and temporal resolution when compared to scintillation detectors. However, these semiconductor detectors are highly susceptible to performance degradation due to radiation damage. Now, solid-state detectors are most commonly made from lithium-drifted germanium. SPECT-CT is derived from SPECT, where a low-dose CT is included in the scanner. Now typically, in a SPECT-CT scanner, the CT component is not of the same diagnostic quality as a standalone CT. However, the CT used in a SPECT-CT is used to actually enhance the images through a process called attenuation correction. Now, a little bit about attenuation correction. Before the gamma ray reaches the detector, particles follow a long path through the patients. Now, some particles may take a very similar path, but may consist of more dense tissue. And there are other factors, such as these, which cause energy losses of the particle, which then result in poor count statistics. Now, poor count statistics also comes into play with poor image quality. So there are many methods to mitigate these, but one method is to actually increase the amount of radioactive material being injected into the patient. However, this is kind of harmful to the patient as they increase their radiation dose. Another method to compromise this is to do a low-dose CT, which usually offers less radiation to the patient than increasing their dose. Now what happens from the CT is we can generate attenuation maps or tissue density maps. We can then correct the detected gamma ray signals according to the distance and the densities they traveled through. This results in superior image quality and helps eliminate artifacts by varying attenuation in the body. And in some cases, tumors or information that were previously hidden or invisible in the SPECT scan now become visible due to the attenuation correction with the SPECT CT. Now, an alternative to having a SPECT CT is to use a standalone CT for attenuation correction. Now, this means the patient will be first imaged on the CT and then they'll be moved onto the SPECT camera. While this method can still improve the image quality, what can happen is that the organs can shift through the movement of the patient, which then makes it difficult to align the CT attenuation maps, even if the physical body is still is roughly in the same configuration as before when the CT was acquired. Now let's talk a little bit about the images acquired. So in SPECT CT, like SPECT, multiple 2D images or projections are acquired at various angles. Special reconstruction software is then used to convert these 2D projections into a 3D tomographic image. Now, these compared to other modalities in nuclear medicine such as PET, SPECT offers a slightly reduced spatial resolution with around 7 to 8 millimeters, but has higher temporal resolution between 1.5 to 3 microseconds. With the use of newer hardware such as solid-state detectors, both of these metrics, so spatial resolution and temporal resolution, can be improved significantly. In addition, with the use of more advanced reconstruction techniques, we can also improve the image quality. So one method that's routinely being used now is iterative reconstruction. And this newer method of reconstruction allows for better image quality. So thus we can either reduce the dose and maintain the image quality, or maintain the dose and improve the image quality. Now some researchers have also used newer SPECT cameras and SPECT CT cameras with the new solid-state detectors to perform dynamic imaging, which was previously only done with PET, and have even validated it against PET, which is a superior nuclear medicine imaging modality. Now SPECT imaging is typically superior, or SPECT CT imaging is typically superior to that of traditional gamma imaging with regard to disease localization. SPECT CT can also be used for tumor detection, infection imaging, thyroid or bone imaging, and is routinely used for cardiac applications such as myocardial perfusion imaging, which basically determines the state of the tissue, whether it's alive, hibernating, or scarred. SPECT has also been used for functional brain imaging. In recent years, there have been a global shortage of radioisotopes, specifically molybdenum-99, which is actually the parent isotope of technetium-99, one of the most common isotopes used in nuclear medicine, specifically SPECT CT imaging. Now this has resulted in the industry to find alternatives or other more efficient methods of imaging with technetium-99. Thus the use of SPECT CT can help reduce the amount of technetium-99 or other isotopes being used for image acquisition. In addition, there have been concern for the amount of radiation exposure associated with in nuclear medicine. However, with the use of newer technologies such as SPECT CT, newer detectors such as solid-state detectors, advanced reconstruction techniques such as iterative reconstruction, we can reduce the associated radiation dose and still improve image quality. So, that has been our mini lecture on SPECT CT. Well, I hope you enjoyed it, and we'll see you next time. Thank you.